Hello, this is a presentation by Nancy durousseau called Compliance Presentation for the Healthcare Ethics and Medical Law class by instructor Linda Hope. This is to talk about the different laws in healthcare. The table of contents goes into showing you about the Code of Ethics in Healthcare, the Health Insurance and Portability Act, also known as HIPAA, the Stark Law, and medical malpractice. The table of contents is basically to introduce the piece. The Code of Ethics in Healthcare basically is the values an institute will strive to follow in order to provide quality health care to patients. Code of Ethics is the manner in which personnel should strive to be. This talks about the values, the mission, the Code of Ethics in a medical facility. The values is the starting point and the integrity part. The vision is what the facility strives to be, and the mission is the goals. And the Code of Ethics is the behavior of the medical facility. Healthcare Insurance Portability Act was passed in 1996. It was used to protect patients' information when they go into the hospital. No information is supposed to be given out to another facility unless a patient requests it. This is the guy, Peter Stark, who started the Stark Law. The Stark Law is limitation on certain physician referrals. It prohibits physicians' referrals of designated health services. Mr. Stark was in Congress for over 20 years. This is the Stark Law and how it works. It talks about the federal law. The pictures basically shows you different parts of the law, and it's going to show you in the next piece how it works. This shows you that there are penalties when you break the Stark Law. There's a $15 fine for doctors who try to refer patients illegally, and it goes all the way up to $100,000. This talks about the Stark Law was created to stop unwarranted referrals, prevent all fraud of Medicare, and to stop kickbacks, which is unneeded tests, medical procedures, and protect the patient and the government from abuse by facilities. This basically shows you the kickback statutes, which it is illegal for healthcare providers to offer inducements to gain care and referrals from physicians or solicit anything or any monies. This here basically shows you the rules, the regulations, and to stop medical fraud and to follow the rules and the regulations of the Stark Law and the anti-kickback law. This talks about medical practice is defined as improper, unskilled, or negligent treatment of patients by a physician, dentist, nurse, pharmacist, or other healthcare providers. And negligence is incorporated into what they call the tort law. This here talks about patients' rights and legal consent. A doctor must get consent from a patient in order for them to even touch them or to perform any type of medical procedures. This here is in case of an emergency. That patient has a right to be treated regardless if they have ability to pay, if the situation is especially a life or death situation. No facility can turn them away. This here talks about the medical experimentation and the right to die. There are medical facilities that do experiments on patients, but in this day and age there are laws to protect patients from this, and if there's an experimental drug, they have to get permission. The right to die basically is in certain states talks about right to die. Medical practice is basically the malpractice in which a doctor makes a mistake and can be sued by a patient. going back to our Right to Die Act, there are some states that allow a patient to have assisted suicide. This here talks about the summary of compliance presentation, and talks about the law, and it talks about the Stark Act, the Code of Ethics, the medical malpractice, and patients' rights. And in conclusion, we talk about patients' rights, the policies in which it follows, the right to refuse treatment cannot be allowed. A patient can refuse treatment, but in some states they're trying to make it illegal to try to force patients to continue to do treatment. And this is my references. And this concludes this piece, which talks about the different codes and ethics of medical law.